So I think the sequence was very good to have Dr. Pierce's presentation in advance of mine. And I'm hoping that my presentation will be able to really pick up on his, oh, gracias. Oh, leave it on the floor. We'll be able to pick up particularly on his last slides of the things that you can do easily next week. I'm not sure I agree with Dr. Pierce that it's so easy. It's hard to make a change. So my presentation has two parts. So the first thing is to connect what I was speaking about earlier this morning related to choosing wisely and overuse in healthcare to the climate crisis and to pollution and waste. The second is to offer three very general high-level approaches for clinicians to make an impact next week, next year, over the coming years in their practice related to the climate. And the last is I want to offer some specific examples from the hospital setting, hopefully that are relevant to surgery and anesthesiology. So we know that climate change impacts the health of populations, the health of patients. This is a graphic from the Public Health Agency of Canada. I won't go into it in big detail, but I think we see that the crises that we're experiencing in our world today, migration, I know something, very common now in Colombia, a lot of it is being driven by, and in the surrounding region from Venezuela and other places, is being driven by climate, food insecurity, severe weather events that are ruining people's crops and livelihoods and communities. We know, and in particular, we know that the climate crisis and the instability in our environment is particularly impacting those who are most vulnerable, those who are poor, who have the low health status. So climate change impacts the health of everybody, but in particular impacts, lowest socioeconomic status. So I wanted to re-show you this graphic from earlier today, and I'm going to focus on the harms of overuse in healthcare to our planet. So this is a graphic from colleagues in Australia, and what they indicate here is the overall carbon footprint of healthcare in that country. And they show about 80% of it is related to clinical care, 20% of it related to, building, the physical plant, electricity and gas. Now, there are estimates globally that about 30% of healthcare is low value. So an example of low value care would be a chest x-ray in advance of a, knee arthroscopy in a well person. So if we have this overall carbon footprint of healthcare, what this paper from the Medical Journal of Australia showed is that a significant proportion, 30%, is low value, and they say 10% is harmful, iatrogenic injury. So we have a real opportunity when we reduce waste in healthcare and when we reduce unnecessary tests and treatments to also reduce the carbon footprint of healthcare. So this is an article that I wrote with some colleagues earlier this year. And what it really highlights is three things that clinicians can do to reduce overuse and have an impact, not on the climate. So we talked about the harms of overuse to patients, to the healthcare system, to providers. But what this paper tries to do is make a connection between reducing overuse and reducing the climate impact of one's practice. And so in this table, and I'm not going to spend a lot of time talking about desflurane, but we wanted to give examples. What are ways that people can reduce their waste and their climate impact? So one, for anesthesiology, reduce gases, and then we can measure that as well. And so these are the three things that our article talks about, and I'll go through each one. So by adopting choosing wisely recommendations in your practice, you can reduce your climate impact. You can also introduce sustainability as a quality improvement target. I understand the previous day's meetings have been focused on quality and patient safety. Increasingly, sustainability and climate outcomes are being measured and used for quality improvement projects. And last is advocate for a climate-friendly healthcare system. And again, I really want to applaud the organizers of today for using this focus, because that's what we're all doing here today. We're becoming more educated about opportunities to make a more climate-friendly healthcare system. So if we choose wisely in practice, there are co-benefits to the climate. We can avoid harm to patients, we can decrease waste, and we can also reduce the carbon footprint of our practice. So I wanted to just show this image. This comes from the NHS. And so Dr. Pierce focused a lot on desflurane. You're all anesthesiologists. What I would like to emphasize in this talk is that desflurane is one small piece of the puzzle. So we see here anesthetic gases and meter dose inhalers. They're significant, 5% of the carbon footprint, but look at everything else. In particular, medicines, medical equipment, and the supply chain constitute well over 50% of the carbon footprint of the healthcare system. So it's not enough to just do anesthetic gas substitution. And I know in many places, desflurane has already been increasingly phased out. So this may be interesting to you. It is not only anesthesiologists who have a high carbon footprint from their practice, but this shows in this graphic, I'll take a minute just to explain it, the various carbon hotspots in the NHS in the UK. So pink is acute, and that's, the hospital sector, surgery, where many of you work, but green is primary care. I wanted to draw your attention here to this tall bar here. So your primary care colleagues have a very high carbon footprint when it comes to their prescribing, because these are the individuals who are prescribing a lot of medications to patients in the community setting. And as I showed you in my prior slide, the supply chain of medications has a very significant carbon footprint. So this is just an illustration of that. When medication is prescribed to the patient, there's a whole process that takes place in order for that medication to reach the patient. There's the manufacturing of that medication. There's waste from that manufacturing that can leach into the natural environment. There's transportation of these medications, not only to the patient, to the pharmacy around the world. There's the carbon footprint associated with the visit between the clinician and the patient. There's the plastic waste around the medication. There's side effects. There's improper disposal. So we need to look at the big picture. And this is just one illustration. But again, I want to show and illustrate to this group that there's so much more that anesthesiologists can do aside from simply changing practice related to gases. So the second is to draw on sustainability to inspire quality improvement projects. So I'll just show you one really nice example from some individuals in Ottawa, which is a city near where I live. And so this is a group of residents. So they did a quality improvement project to minimize postoperative day one blood work in patients undergoing uncomplicated bariatric surgery. So they have a number of different measures, as you can see in the slides. And what they said is, for patients that don't have, for patients where it's possible and there's no concerns postoperatively, they can reduce blood work. And one of the measures that they added, in addition to the clinical measures here in the table, was financial and environmental cost savings. So they saved 940 test tubes from a landfill. Now that seems small, but I think what it is it's inspiring, because it's not only saying that by reducing unnecessary blood work, you're improving resource use at your hospital, you're reducing harm to patients, you're also reducing harm to the climate. And this is the mindset that we need to be using in our work. Not only are we thinking about dollars and patient outcomes, and resources, we're also thinking about the climate. So I find this study very elegant as a nice example of a quality improvement initiative that measured the climate impact. And again, it can be very challenging to measure greenhouse gas emissions. You folks work with gas. Gas is odorless, it's colorless, we can't see it. We can't measure it. Dr. Pierce's slides are very interesting to me, but I have a hard time understanding what is a unit of greenhouse gas emissions. I don't work in that space, but I do understand it's very tangible what a blood tube is. And so this, again, is a very elegant way to measure climate impact. So the last thing is, in general, is to advocate for a climate-friendly healthcare system. And again, I really want to applaud the individuals who organized, the physicians who organized today, because so much is about teaching and raising awareness, leading from where you stand, encouraging colleagues to consider these issues when it comes to climate, potentially working with your societies on this work, and also potentially doing advocacy with societies, with government on these topics. So we were talking, Dr. Guerrero and I were talking about learners and the next generation. And I wanted to acknowledge the learners. I don't know if there's any trainees in the room, but I became very interested in this topic because it was the students, my students, who came to me and said, we need to be talking about the climate impact of our work. And in Canada, these are some of the students who I work with. Some of them are now physicians and residents, but these individuals created a group called Canadian Federation of Medical Students Heart. And they're an advocacy group for students to teach about planetary health, to support quality improvement work, to do advocacy to government, to communicate with their peers about the importance of this. So very inspiring to see the next generation of leaders who really care about these matters. So the second part of my talk is around hospital-based strategies to reduce climate impact. And I wanted to just very briefly show this review. It compares the climate impact of 3 ORs, 3 operating rooms in Canada and in the United States and in the UK. And what they found, they compare different environments. There's different issues related to heating and cooling, which impact some of the carbon impact. But overall, what they found is that operating theaters were found to be 3 to 6 times more energy intensive than the hospital as a whole because of heating, ventilation, and air condition. So they're not talking about desflurane here. They're talking about the overall OR in the hospital, the overall environment. And so Dr. Pierce actually had this paper from BMJ here around the environmental impact of anesthesia. I won't go over it in any detail, but this is a very nice infographic just to show again, the various climate impacts of anesthesia and opportunities for substitution. So again, and this is the article in a little bit more detail. So of course, anesthetic gas substitution is an increasingly important topic within the global anesthesiology community. He showed a number of these. This is an article I really like in the anesthesiology patient safety group in the United States. They have a great podcast as well. It's linked on the bottom. And what they highlight is sustainable care. Healthcare must be the next patient safety movement. And they give a number of different opportunities here to reduce the impact of anesthesia. So desflurane, of course, but then they talk about, some other technical things, checking for leaks in nitrous oxide piping, the transition to propofol, using low fresh glass flows to reduce unnecessary consumption of other anesthetics. And then importantly here, advocating for vendors to focus on sustainability and designing products for the circular economy. So also working with industry to make some of these changes. So again, I want to show you this to remind us about the overall climate impact of the OR, of the operating room, and suggest some examples and some tools from Canada where operating room sustainability and greening efforts have been conducted. So this is just one of the tools from colleagues in Canada at a group called Sustainable Healthcare Systems. And they, again, highlight the energy intensity of the OR. So ORs can generate 1/3 of hospital waste in Canada. That ORs and medical supplies and energy for ORs is 6% of Canadian hospital budgets overall, and a major source of emissions. And it's not just, again, the anesthetic gases, it's the disposable materials, single-use devices, medical waste disposal, and importantly, energy consumption in those settings. So what they highlight are 4 different things that one can think about in the OR. This is a guidance document. Again, there's a link there. And this was developed through the best practices in surgery and Center for Sustainable Health Systems at my university, University of Toronto. I didn't develop this, but my colleagues did, so I like to share their work. And so they highlight 4 steps. One is, oh, where's my thing? Reduce. So reduce your energy use, reduce waste, reuse, switch from reusable to disposable when possible and when safe, recycle. So develop and implement programs for that, and then rethinking. So anesthetic gas substitution and waste management techniques. Now here we're again, and this is, oh, sorry, I'll just show you one other initiative. So this is another initiative through the OnSquin. It's called the Ontario Surgical Quality Improvement Network. And they have a number of different QI initiatives. And one called Cut the Carbon focuses on reducing waste in particular. So patients can bring their own garment bags to their procedure, using reusable containers perioperatively, non-desflurane anesthesia, custom packs optimized for procedures, changing surgical trays to ensure that equipment is not being wasted and thrown out, and using reusable surgical gowns. And importantly here, what they include are measures. Now we know in quality improvement, if we can't measure the impact of our work, it becomes much more challenging to make a change. So here they include some process measures. And again, my personal point of view is it can be challenging to measure the impact of our work in greenhouse gas emissions. We don't understand it. We don't see it. It's hard to quantify that. We also often don't have the resources, the technical skills in our hospitals and with our colleagues to measure our carbon footprint and our emissions at a high level. But what we can do is create clinically relevant measures here. So number of surgeries where a custom pack was optimized for the procedure, and make some changes that are very tangible and easy to do within the hospital environment. So the last toolkit that I wanted to highlight was a toolkit for sustainable perioperative care. And so this was developed again, in part by colleagues at a group called Cascades, again, another group focused on climate and sustainability and planetary health at University of Toronto. And why I wanted to end with this toolkit is that it brings together reducing overuse and reducing waste within perioperative care specifically. So what they talk about here are a number of different pathways to reducing carbon in perioperative care. And again, we have to remember the goal here, we're increasing our quality goal now to include not just patient outcomes and costs, but to include low carbon care and sustainable care. So what they've done here is highlight reducing overuse. So if you reduce your activity and avoid unnecessary care, a co-benefit of that is that you're reducing the carbon impact of your work. So the two steps that they highlight are cutting out low-value preoperative visits and testing. And again, there's so much waste that comes from that low-value preoperative visit. The patient could be driving from a far distance, the materials that are used, the time. There's a lot of elements to that. And also practicing wise blood use. So in Canada, we have a national blood agency. Blood is a very limited resource. Blood is also transported across the country. I don't know the blood system in Colombia and if the same thing exists, but the transport of blood is a very carbon intensive activity. So they highlight practicing wise blood use, avoiding unnecessary transfusions. For example, avoiding a 2-unit red blood cell transfusion when 1 unit will suffice. And then they talk about reducing environmental activity. So here, minimizing direct emissions. So thinking about desflurane and nitrous oxide and anesthetic substitution here, considering reusable alternatives. So reusing, changing the laryngeal masks to be reusable, and extending use of disposable breathing circuits, not throwing out all of the equipment if possible, and then reducing and managing waste here has different opportunities. So optimizing packs, allowing for buyback, and again, working with industry to try to make some of these changes. And so then this is just a little bit more detail about how to do this in practice. So I wanted to share this with you all and just again highlight that there is so much more to sustainable anesthesiology and perioperative care than simply desflurane, reducing or substitution of desflurane and nitrous oxide. And here they don't even talk about heating and cooling and the physical plant. And so the last thing I wanted to add, being that I work in health, teaching health administrators, is that these are very valuable partners in making these changes. And a lot of these changes, Dr. Pierce says it can happen tomorrow. A lot of these changes require collaboration across the hospital with different partners, with individuals involved in supply chain, physical plant, procurement. So there's a significant need for partnership and collaboration across your organizations outside of anesthesiology, outside of the surgical OR, in order to make these changes. So with that, I will finish.